Hello, my name is Chang. Today I'm going to talk about HiDisc, our paper featured as a highlight in CVPR 2023. I'll start with a short minute-long summary. Learning high-quality visual representations is essential to advance the role of computer vision in biomedical microscopy. Previous self-supervised methods focus on instance discrimination applied to patches or patch discrimination. Our key insight is that sampled patches from each host slide or each patient form a diverse set of image examples that capture the same underlying diagnosis. Therefore, we define positive pairs based on a common ancestry in the data hierarchy to learn a slide and patient level discrimination. We benchmark HiDisc on two image modalities and demonstrate that HiDisc outperforms the state-of-the-art methods. Qualitatively, HiDisc also achieved better feature learning and class separation. Now let's dive into more details. Biomedical microscopy is an essential imaging method and diagnostic modality in biomedical research and clinical medicine. Digital pathology and whole slide imaging has increased the role of computer vision and machine learning to analyze microscopy data. Biomedical microscopy presents several unique computer vision challenges, including that image resolution can be very large. The annotations are often limited to weak slide or patient level labels. Because of large image sizes and weak annotations, most research are focused on patch-based multiple instance learning that rely heavily on weak annotations. However, even weak annotations are challenging to obtain due to varied testing availability and patient privacy. These limitations necessitate better self-supervised representation learning of biomedical microscopy. Most existing research in biomedical microscopy representation learning are focused on applying state-of-the-art self-supervised methods directly to patches for visual pretraining. There are a few limitations to this approach using instance discrimination or patch discrimination as the pretext learning task. Patches belonging to the same slide or patient are correlated, which can decrease the learning efficiency. Previous self-supervised methods neglect the inherent patient slide patch data hierarchy for clinical biomedical microscopy, which can be leveraged to improve learning. And lastly, most self-supervised methods require strong domain-agnostic data augmentations for instance discrimination, which can corrupt semantically relevant features. The key insight that inspired HiDisc is that sampled patches from each host slide or each patient form a diverse set of image examples that capture the same underlying diagnosis. And the patient slide patch hierarchy enables us to define positive pairs based on a common ancestry to enable slide and patient level discrimination. For example, in patient discrimination, different patches from the same patient form positive pair at the patient level. And similarly, in slide discrimination, different patches from the same host slide form positive pairs at the slide level. HiDisc is a general self-supervised learning strategy and can be used in conjunction with any Siamese representation learning method. It is simple to adopt HiDisc to the training workflow. After the forward pass, we compute the HiDisc losses at each discriminative level with different sets of positive pairs. In our paper, we focus our experimentation on contrastive learning using a loss function inspired by supervised contrastive loss. The fundamental difference between our loss function and the supervised loss is that no class labels are being used during training. Instead, the positive pairs are defined at each level of discrimination based on whether the image and the anchor shares a common ancestry at each level. Finally, the HiDisc losses for patch slide patient discrimination is weighted using hyperparameter lambda at each level. We evaluate HiDisc using two different histopathology tasks: multi-class cancer diagnosis with stimulated Raman histology and molecular genetic mutation prediction with the publicly available TCGA dataset. Predicting molecular genetic mutation is a challenging task because it is not feasible even for a board-certified neuropathologist to diagnose visually. Comparing HiDisc to the state-of-the-art self-supervised learning methods, we can observe that HiDisc with slide and patient discrimination outperform all baseline methods in all metrics for both tasks. As expected, HiDisc with patch discrimination performs similarly to the SimCR baseline. Qualitatively, we compare representations learned using HiDisc to SimCR in the SRH dataset. In the top tSNE plots, the representations are colored by brain tumor diagnosis. We can observe that HiDisc qualitatively achieve better feature learning in class separation compared to SimCR, and as expected, HiDisc shows within diagnosis clustering that correspond to patient discrimination, as visualized in the zoomed-in view at the bottom of the figure, where representations are colored by patient. Importantly, we do not see patient discrimination within normal brain tissue because there is minimal to no differentiating microscopic features between these patients. An important ablation study we performed is to demonstrate that HiDisc is capable of preserving excellent performance without the use of strong domain-agnostic data augmentations. As expected, both SimCR and HiDisc with patch discrimination collapsed, since weak augmentation will make the pretest tasks trivial. HiDisc with slide and patient discrimination are only slightly affected by the lack of strong augmentation. This can also be observed in tSNE embedding visualization. HiDisc is able to achieve high-quality representation learning, where SimCR is unable to learn semantically meaningful features via instance discrimination alone. In conclusion, HiDisc leverages the inherent patient slide patch hierarchy of clinical biomedical microscopy for self-supervised learning. HiDisc outperforms existing self-supervised learning methods for cancer diagnosis and genetic mutation prediction. And finally, HiDisc learns visual representations leveraging natural patch diversity without the strong augmentations. For more details, including our full paper in GitHub repo, please visit our website at hidisc.emlins.org. Finally, I would like to thank our co-authors and collaborators in the Machine Learning and Neurosurgery Lab at the University of Michigan. I would also like to extend our gratitude to our sponsors whose generosity make this research possible.